Because I've been a licensed medical professional for over 20 years, a lot of people have been asking me lately, what do you think about the vaccine? What's your opinion on the vaccine? So my answer to that is really, my opinion doesn't matter. My thoughts don't matter about the vaccine. What really matters is that everybody can make their own decision about whether or not they want to take the vaccine. And in order to make that decision, people need to have information. They need to go through a process of gathering information, talking to trusted people, and then making that decision for themselves based on their situation, their health status, their lifestyle, what's going on in their lives. I had gotten into public health originally because I thought it was really great, and I was really excited about public health, thinking, a lot of people want to be healthy, but they're not, and they just need the information so that they can improve their health, because once they understand certain things, they'll say, oh, well, I'm not going to do that. I'll do this instead. And they can improve their health on their own. So I really liked that idea. But I quickly found out that that's not really kind of how public health works. Give one example. So if you look back in the old days of like the marketing that they had for cigarettes and cigarette smoking, they had, a lot of things about like smoking's health benefits, and it won't irritate your lungs, or, all these kinds of messaging that was promoting smoking and saying it was okay for your health. How later on, then we scientifically were able to establish the connection between, COPD, emphysema, lung cancer, things like that, and, the carcinogens and the toxins that are in the smoke. People could have that information and say, oh, you know what, smoking actually does have a negative effect on your health. But here's where the tricky part comes. So yes, we know that smoking causes problems, but does that mean that now we should go ahead and require a law that says nobody can smoke? No. That shouldn't really be how it is. Public health is supposed to be about informing people, educating people so they can make their own choices. And if somebody understands fully what the risks are of smoking, but for them, the benefit outweighs the risk, that's their choice. That should be their choice. As counterintuitive as it may seem with smoking, because we're really everybody kind of believes that smoking is not good for your health. But the point is that people should be able to make that decision for themselves. Whereas being involved in public health, I've noticed this trend towards, public health just not being used to empower people, but being used to control people in a sense. Making laws requiring, you can't have a drink of a certain size if it has a certain amount of grams of sugar, and, restaurants have to be required to, comply with all these regulations. So just kind of along that lines, the reason why I wanted to make this video is so that I can do what I wanted to do with public health and give people information so that they can have that information, and they can also develop a mindset of how to make healthcare decisions on their own by using these types of tools. So let's look at another example. Say somebody has to have their gallbladder out, right? The doctor's not going to come along and say, okay, you need gallbladder out, I'm going to cut it out. Sound good? Okay, let's shake. That's not how it works. The doctor's required to really go through a process called informed consent, where they're going through all the risks, all the benefits of the procedure, and then they talk about alternatives. What else can we do besides this procedure? And then what are the risks and benefits of those alternatives? Okay, and so they're looking at all of this information together, and they're also looking at the person's individual health, right? Like if somebody needs their gallbladder out, let's say they're 30 years old, they have no other sicknesses, they live at home with, their parents, and, they're gonna have their gallbladder out. Fine, that's their information, they'll make their decision. Let's say somebody else is 65 years old, they have coronary artery disease, they're obese, they're the sole caregiver of a family member with Alzheimer's, and they have to have their gallbladder out. So there's two totally different situations. So they may come to different decisions, right? So any decision that you make, you really need to go through that process and it's the same thing with the coronavirus, with the COVID vaccines. Now, different people need different amounts of information, right? So we're talking about informed consent, and there's a lot of information, right? So some people, they'll take a little bit of information and they're fine with that. They'll make their decision and go on. Some people, they want more information. and before they make their decision. And some people really need more information. So like if you use an example of like, let's say you go to a restaurant, right? And you're looking at the menu and, somebody's like, yeah, give me the best thing on your menu. And the waiter is like, okay, yeah, it's sweetbreads. That's the best thing on our menu. Okay, fine. Give me that. I'll have that. And that's it. They made their decision, right? They got the information, what was on the menu. They talked to what they believed was a trusted person, the waiter, and they made their decision. Now, somebody else might say same thing, like, yeah, I want to have what's really good on your menu, And the waiter says, okay, it's the sweetbreads. And then they say, all right, yeah, well, what is that? And then the waiter tells them what it is. And they're like, no, I don't want that. I'll get the pasta or something, So they're getting a little more information to make their decision, right? And then somebody else, let's say somebody has, a severe history of allergies, of food allergies. So they're like, yeah, give me the best thing. Okay, yeah, what's the ingredients? How is it prepared? What type of, utensils are used? Are they cross-contaminated? They might be really, really asking a lot more information. So there's varying levels of information that different people could want or need, right? But the bottom line is that whatever decision they come to, that's their decision. And myself, in the medical field and just having this knowledge, I would support somebody if they wanted to take the coronavirus vaccine, and I would support somebody if they refused the vaccine, and I would also support somebody if they just didn't know and they needed more time to make the decision to go through the process. Now, I want to say that I'm going to be using a tool that I use a lot as a health educator. I'm also a certified health education specialist. So one of the tools I use is this acronym called BRAIN, where we discuss the benefits, the risks, the alternatives, what my intuition says about it, and no, not now. Like, what if I don't do it right now? So that's one of the tools that I use. And and as we go through this and I'm presenting some of the information, I want to say I'm really the most boring person in the world. I don't watch TV. I've never had TV in my house, so I don't watch any kind of mainstream media. I don't watch a lot of YouTube videos, so I'm probably not going to be good at making videos. But pretend we're just having a conversation, and I'm your health educator, and you want some information. So don't look at it. Don't expect this to be a high quality video. So, my information that I'm giving you isn't from news sources, although I do pick up some of those headlines. Most of the information that I'm giving you is from clinician guidelines, from medical journals, from research, from more of the medical and scientific stuff. So, and we'll be looking at the Pfizer documents as well from their research. So just wanted to give you a little bit of perspective where the information is coming from. And I'm not giving any guarantees that everything's 100% accurate. I'm not giving you any medical advice. I'm just giving you some tools in this whole situation with, should I get a vaccine? Should I not get a vaccine? So, all right, so let's get started and talk about the benefits, right? So the biggest benefit people would say is, I want to get the vaccine because I don't want to get coronavirus. I don't want to get sick with COVID. So that assumes that the vaccine itself is effective, right? That the vaccine works. And we're hearing all this messaging about the vaccine is 90% effective, 95% effective, 70% effective. However, we really need to drill down into the terms, because in science, the words really, really matter, okay? So there's a difference between effectiveness and efficacy. All right, when we're hearing these rates, they're really of efficacy rates. They're not effectiveness rates. And I know the words are kind of used interchangeably because, journalists are writing about it, and to be a good writer, you don't want to say the same word over and over. You want to use good language. So they're using those words interchangeably, but they're not interchangeable words in science. They have two different meanings. So the efficacy rate refers to the rate that they got from their data in the science experiment. So when they were doing this controlled randomized trial, they were taking the data, using those numbers to get an efficacy rate. So the efficacy rate refers only to the study. So what does that mean? What's the difference? Well, the difference is that in a study, it's super structured, super organized, very, very controlled. The people doing the study have full control over everything. All the variables that are in the study are being manipulated and controlled, right? They have their placebo group, they have their group that's getting the actual drug, and they've picked this group, right? This group of people are supposed to be random, right? But they do have, because I have the Pfizer document right here in front of me, and they do have stipulations and regulations for who can be in the study and who can't be in the study. Okay, so the population of the people that they're testing is a specific group of people that they've interviewed, they've assessed them, and they've chosen them for the study. Okay, so that's one difference, because we're taking this group of people and we're taking the results from them and we're applying it to everybody in the world. But everybody in the world wasn't part of that study, right? People with cancer weren't part of the study. Children weren't part of the study. Pregnant women weren't part of the study. People with certain other diseases weren't part of the study. So therefore, the generalizing the results to the entire population is a little bit difficult. So that's where an effectiveness rate would come in, where we're looking at the whole population. We haven't done that yet. It hasn't been even a month since the vaccine's been out, right? Today's February 5th, so of 2021. So another factor that would influence the difference between effectiveness and efficacy is these providers. So in the study, they have skilled providers. They're investing a lot of time and money in the study, right? So they're not going to just take their low-level people and have them implement this program. They're going to have very skilled providers who are trained to implement the protocols according to the same exact way. So every provider is doing it exactly the same way. So in real life, it doesn't really work like that, right? For different providers are doing different things. We see in England, they're switching up the second doses. They're kind of mix and matching between the different brands of vaccine. You have different people here in New York. We have a high population in New York, so they have just recently passed a law, or maybe it was an executive order, but they opened up the amount of the people who can actually administer the intramuscular injection. Normally those are done by a doctor or a nurse, but now Governor Cuomo has opened it up so that other people can also administer it. It's a big job to vaccinate 20 million people, so they're trying to expand the number of people who can give the injections. So they're now allowing students, pharmacy techs, EMTs, and these people are probably very skilled, but they don't have the experience likely because they've never been allowed to do these things. So this is very new. So they may not have the experience and the level of skill that the people in the trials had, right? So there's a difference there. There could be a difference there in the way the drugs are administered. So, there's a lot of differences there with a randomized control study and real life.
There are a lot of other little factors that can contribute to the difference between an efficacy rate and an effectiveness rate. So if we take a look at this sheet, we can see all these details about how it's to be stored, how it's to be thawed, the vaccine, the method for thawing the vaccine, the method for reconstituting the solution. Do not shake, observe it. It may contain white to off-white particles. Do not use if discolored or other particles are observed. So this is method of observing it to make sure that it's ready to be administered. Also using 0.9 sodium chloride injection, exactly 1.8 mLs of it needs to be used. And so there's all these details on this page that are outlining. And so this page, the providers will read this and they'll be able to just go ahead and administer the vaccines from using this information. However, in the trials, everybody really gets taught this and trained this exactly the same way. They don't just read the paper and kind of figure it out on their own, because people can interpret things differently. So they all get trained how to do it exactly the same way, so that it's being administered exactly the same way each time, according to the same exact protocols. Nobody's, it says here that it has to reach room temperature before dilution and must be diluted within 2 hours. So during the study, they're going to make sure that that's happening correctly. And then sometimes in real life, things don't always work out exactly, the way that we plan them to. So this can contribute to some differences in those two different rates.
Right. In real life, anything goes. People are people. They don't follow the textbook. Things happen, So one example of this would be with tuberculosis, when they were doing the trials to try to get a cure for tuberculosis, because that was a huge public health problem, right? So they were really excited. They're like, we got it, this works. And then in their trials, they had good results, right? They had good numbers. But then in real life, what happened was people didn't like taking these medications every day for 6 to 9 months. That's a long time, and the side effects they had to deal with and everything. So they kind of stopped taking it. And what happened was, instead of curing the TB, they ended up getting super strains of the TB, resistant strains of the TB, and their effectiveness rates weren't like the efficacy rates, right? So in the trials, it was working great because everything was really controlled. But then in real life was happening, and it wasn't the same. So there is a big difference between efficacy and effectiveness. So if you're basing your decision to get the vaccine off of its effectiveness, we don't have that data. We really don't have that data. We have data on efficacy, and that's different. So it's important to understand that when you're using that information to make your decisions.
We also get this information from the cover page of the Pfizer document that outlines the protocol for their clinical trials. The title of this cover page, it says, a phase 1-2-3 placebo-controlled randomized observer-blind dose-finding study to evaluate the safety, tolerability, immunogenicity, and efficacy of SARS-CoV-2 RNA vaccine candidates against COVID-19 in healthy individuals. So here it's telling us that they're looking for the efficacy rate. That's the data that they're going to get. They're evaluating those factors. They were actually testing 2 vaccines in the trial. There were 2 candidates, so that's why it says candidates. And it's in healthy individuals. So they're telling us the population sample that they're using is healthy individuals. The data they're looking for is efficacy, safety, tolerability, immunogenicity. And that the study, it also says the study was sponsored by BioNTech and it was conducted by Pfizer. So just looking at that cover page, it doesn't say they're looking to see how effective the vaccine is. It says they're looking to see the efficacy of the vaccine.
Benefit that people would have from getting the COVID vaccine would be that they don't want to transmit the disease to others. And that would be a great benefit. However, again, we really don't have data on that, okay? So in the Pfizer study, their endpoints for basically their endpoints during the study was if somebody got a COVID and they had a chart and they had symptoms and they kind of had their parameters for what that looked like if someone had COVID. So their endpoint was symptomatic COVID. So their endpoint was not asymptomatic COVID. So there's a difference between sickness and infection, right? So you can even take it one step further. You could be contaminated with COVID, but your body can overwhelm it and kill it, and then it's gone. So you're not even infected, nothing, right? Or you could be infected with COVID, like the COVID's all in your body, but you're not sick. You don't have any symptoms, right? If you're sick with COVID, you're infected. But if you're infected, you're not necessarily sick, right? So in the Pfizer study, they weren't assessing these asymptomatic people, or essentially the people who could have been infected but not sick. So because we don't have any data on that, we don't have any data on the transmissibility, the effect of the vaccine on transmissibility. So we really don't have the data that tells us, is the coronavirus vaccine going to be effective against helping to prevent the transmission of the disease? Okay, so visit 10 occurs 24 months after the beginning of the study. So if we look at the timeline, right, we started getting reports of COVID infection back in December 2019. It's now February 2021. So we've only had this disease a little over a year. We've only had the vaccine for a couple of months. So if you look at that timeline, and the Pfizer vaccine study is saying that the visit 10 occurs 2 years after, it's not possible that visit has occurred yet. So according to their protocol, their study isn't over yet. So that's another factor that kind of limits the amount of data that we have to make our decisions on. Okay, so if we look at the page 6 of the Pfizer clinician guidelines, it says Pfizer BioNTech COVID-19 vaccine may not protect all vaccine recipients. And that's pretty consistent with all the information that we have about vaccines. No vaccine is 100% effective. No vaccine protects all of the people that are vaccinated, right? There's always that percentage of people who aren't protected by it. So that's something to consider. The other thing to consider too is that we've seen multiple strains, right? There have been different strains coming up. So we really don't have data on the effectiveness of the vaccine against those other strains. There's just not enough time in the timeline yet to even gather that data, let alone, kind of statistically analyze it and things like that. So there's the question of, would the vaccine be protective against the other strains? So as it rolls out and as this is going on, they'll be gathering more data and we can get more information about the effectiveness in real life, in real world populations. But I don't want people to think that they're basing their decision to get the vaccine off of effectiveness when we don't have that data yet. So that really is kind of the point that I'm making with that. So another benefit would be that a lot of people feel like they really need to have proof that they have the vaccination. So maybe they're going to have it required for work, or maybe they're feeling like they'll have to have it for travel. So it could be kind of these external pressures kind of making people feel like they have to have that proof of vaccine. So that might be a benefit for them that they're considering. And that does put people in a really difficult position because it's, when you're making a healthcare decision, it usually relates to your health and your body, because you're the one who has to live with that decision for the rest of your life. It usually isn't attached to all different things like being able to work or travel or, do just normal activities in society. So that does add like another layer of difficulty to the whole decision-making process. So that would be a benefit for people to have the vaccine if they didn't want those complications. Also, people might say life will go back to normal. And, once we have the vaccine, this is a lot of the messaging that we're getting, that once we have the vaccine, life will go back to normal. So, there have been cases where epidemics have been resolved with vaccines. The polio vaccine was really effective in decreasing the incidence rate of polio. Same thing with smallpox. So, those are examples of public health situations that were helped with the vaccine. There are different modalities of vaccination, right? Our immune systems, the way they work, when we're exposed to something, we produce a response to it, right? So what are we being exposed to? A weakened virus, or a synthesized virus, or, so there's all different modalities, and we'll talk about that in a little bit. So those are some of the benefits, right? So let's talk a little bit about the risks. So one of the things that people bring up, and this is a valid concern, is that the vaccine is not FDA approved. So there's a difference between FDA approved and EUA, emergency use authorization. If there wasn't a difference between them, they wouldn't be two different things, right? So if we look at the Pfizer clinician data, it says
information to provide to vaccine recipients or caregivers. So this is the section where the nurses or whoever's administering the vaccine would give information to the patient. So it tells us to let them know, to give them a copy of the fact sheet, or let them know to go to the website so they can get it themselves. And the website is cvdvaccine.com. And then we're supposed to explain these 4 bullet points. And it says, FDA has authorized the emergency use of Pfizer-BioNTech COVID-19 vaccine, which is not an FDA-approved vaccine. The recipient or caregiver has the option to accept or refuse Pfizer-BioNTech COVID-19 vaccine. The significant known and potential risks and benefits of Pfizer-BioNTech COVID-19 vaccine and the extent to which such risk and benefit are unknown. And then the last one is information about available alternative vaccines and the risks and benefits of those alternatives. So that's what it says on the sheet. It does indicate that it's supposed to be part of the process is to inform patients that this is not an FDA-approved vaccine.
The FDA issued the emergency use authorization based on Pfizer's request. So Pfizer asked them to do it, and they did, and their submitted data. So it says here, this is a quote from the Pfizer clinician sheet. It says, although limited scientific information is available, based on the totality of the scientific evidence available to date, it's reasonable to believe that the Pfizer-BioNTech COVID-19 vaccine may be effective for the prevention of COVID-19 in individuals as specified in the full EUA prescribing information. Okay, so even Pfizer is admitting that they don't have effectiveness data. They're just saying it's reasonable to believe that it's effective, but they do have efficacy data. So that was what they presented to ask for this emergency use authorization, which they were granted. So it has not been FDA approved yet.
Okay, so why is it important to know that it's not FDA approved? Well, because the study, it says right here on page 17, the safety evaluation in study 2 is ongoing. The study's not over. That means they haven't gotten all their data in and they haven't been able to evaluate everything. So it says that the safety population includes participants enrolled by October 9th and includes safety data accrued through November 14th. So that's just a little over a month of data that they had on these patients. So they're not finished with the safety part of the study. So what they did was they asked for the emergency use authorization prior to the study being completed. As far as what I can tell from what I'm looking at and what I'm reading, that's what it looks like. It says right here on page 17, the safety evaluation in study 2 is still ongoing. So this is, if they were completed with the study, they would have applied for an FDA approval, but they're not. So they applied for the emergency use. So that's a difference.
Okay, so let's just talk a little bit about side effects, adverse effects, and serious adverse effects. So side effects are normally considered like the things that we expect to happen. We expect that you're going to have, some pain at the injection site, fever, fatigue, headache, muscle pain, chills, joint pain, injection site swelling, injection site redness, nausea, malaise, like just a feeling of not feeling good, swollen lymph nodes. So those are the things that are kind of expected, right? So some of the more adverse reactions, the things that aren't expected, although those side effects can also be considered adverse reactions, they are expected. So kind of the side effects are more of the expected ones, and then the adverse reactions are ones like they really shouldn't be happening. Like some of the things that have been reported, Bell's palsy, Guillain-Barré, appendicitis, transverse myelitis happened with the Moderna vaccine. So those are some of the side effects. There was also one patient who ended up getting MS during the trial, but they said that she was going to get it anyway, and that it didn't have anything to do with the vaccine. But those are some examples of some adverse effects. Also, I think it's good to note that in this isn't the clinician guideline to administering it. This is the actual protocol. So page 27 talks about the risk assessment of the study. So it says potential for local reactions, like we just talked about all those side effects. It says unknown AEs and laboratory abnormalities with a novel vaccine, right? So it's a new type of modality of immunization. So they really don't know what to expect. So they're saying, unknown adverse events. And then they also list here potential for COVID-19 enhancement. So this means that they're listing as a side effect disease enhancement. And it says here, disease enhancement has been seen following vaccination with respiratory syncytial virus, feline coronavirus, and dengue virus vaccines. So those vaccines, they have seen where it has disease enhancement. What does that mean, disease enhancement? You're supposed to take the vaccine and then not get sick, right? Well, with that, what happens is when you're exposed to the antigen, which is the germ, right? Your body produces an immune response. It produces antibodies. Those antibodies, what they're supposed to do is they're supposed to go and neutralize the germ to make it ineffective so it can't make you sick. However, sometimes the body will make non-neutralizing antibodies, and the non-neutralizing antibodies don't inactivate the germ, and it just creates this stormy condition in the body, and you have disease enhancement. So instead of protecting, it actually makes it, kind of worse. So they've seen that with these other vaccines. So they're saying that since they've seen it in those vaccines, it could be a potential with this one. So are we seeing that? Is that happening? I don't know. I don't see any data on it or research. But Pfizer said that that was a possibility. So that's something to be aware of in the decision-making process when you're looking at the risks, that they put that out there, that disease enhancement could be a side effect of the vaccine. And then you have serious adverse events. So a serious adverse event was defined by them in their study, and this is pretty much a generally accepted definition, as something that's life-threatening, something that requires inpatient hospitalization or death. So those things are serious adverse events, and we are seeing some of that, right? We've seen reports. I'm not sure what the death count is up to. I saw it was over 50 the last time I saw something on it. So there are people that have died after the vaccine. One of the, when I was looking at one of the cases, one of the serious adverse events, right? This is where it's life-threatening. ITP. So there's idiopathic thrombocytopenia and there's immune thrombocytopenia. So usually if it's idiopathic, they don't know where it comes from. So they'll just be like, oh, your platelets just went out of control and things went haywire and, it was a medical emergency. However, in this case, it was a doctor, an OBGYN doctor in Miami, and he got immune thrombocytopenia. And he was a healthy man. I believe he was like in his 40s. He didn't have any other health conditions. He had a family, he had a medical practice. He got this immune thrombocytopenia. So it was from the vaccine. And he died, I think it was about 2 weeks after the vaccine. He got sick with this immune thrombocytopenia and he died of it. So, we do have a connection there between that disease and the vaccine. So that would be considered a serious adverse event to be aware of. Another serious adverse event would be anaphylaxis. So anaphylaxis is like an allergic reaction that is so bad that your respiratory system is so inflamed that you can't breathe and you could die from it. So people who know that they have those types of reactions, they usually carry an EpiPen. It's a really bad allergic reaction. So the clinician's guideline, let me flip back to the clinician guideline. It says, do not administer Pfizer BioNTech COVID-19 vaccine to individuals with known history of a severe allergic reaction, e.g. anaphylaxis, to any component of the Pfizer BioNTech COVID-19 vaccine. So in order to know if we're allergic to any of the components, we need to know what the components are. So one of the ingredients listed is this polyethylene glycol, and that's been found to have a cross sensitivity with polysorbate. So people with allergies to polysorbate or polyethylene glycol, if they know they have an allergy to that, shouldn't be taking it according to Pfizer's document here. And they do list some other ingredients. I can put the picture of that up here just to give you some more information on that. And I don't know if this is a complete listing of all the ingredients because it doesn't really tell us. It just says it also includes the following ingredients. So that's something to think about if you have a history of allergies for sure. But speaking of allergies, I found this to be really interesting. I was going to share this with you. Okay, so, and I have this notebook where I keep all notes that I've been keeping since the beginning of the whole pandemic, just because I have to give some infection control updates for work, and just, how it relates to what we're doing and just keep everybody updated. So, back in December, I had noted in one of the journals I was reading, it said that severe allergic reactions have been reported following Pfizer BioNTech COVID-19 vaccination during mass vaccination outside clinical trials. So let's look at that sentence for a second. So mass vaccination, that implies a large group of people were vaccinated. And it says outside clinical trials. So that means that it wasn't in the experiment, it was outside the experiment. Now, this was back in December that I read about it. and the emergency, it hasn't been FDA approved yet, but it's been emergency use authorized, and that I believe was also in December. So how could they have vaccinated a mass amount of people before it was even emergency use authorized? Who are these people that you mass vaccinated and that they had severe allergic reactions? That means they had anaphylactic reactions. So who are these people? Where did they find them? What happened to them after they had these severe allergic reactions? Did they get care? Did they get treatment? Did they survive? Did they die? Well, it really kind of leaves a lot of questions there. Yeah, just not sure what's going on with that there, but thought it relates to the allergies, so I wanted to share that information with you as well. So we talked about the regular side effects, we talked about adverse events, we talked about serious adverse events. When you get the vaccination, they're supposed to monitor you for 15 minutes to see if there's any changes in the homeostasis of your body, if anything's starting to go wrong. And if you have a history of allergies, they're supposed to monitor you for 30 minutes to make sure you don't need immediate medical care for some kind of reaction. So I wanted to share with you too about VAERS. VAERS is the Vaccine Adverse Event Reporting System. I'll put the website up. It's a national registry basically of vaccine side effects for not just COVID vaccine, but every vaccine. And you can report it yourself. You can go on to the website and they have it set up where you can report it yourself. And then if you're a provider and you're observing these effects, there are certain guidelines that you actually have to report certain side effects. So that's actually really useful because then we can start to gather data and see what's going on and see if there's a connection, between these side effects and the vaccine and what we should do going forward and things like that. So that VAERS is a good data collection tool to be aware of. And, if you would wanted to report your own side effects, you can do that on that website. So that's good information to have. So let's talk a little bit about how is this vaccine working? How does the Pfizer Moderna vaccine work? What is an mRNA vaccine? So we don't have, this has never been tried before, so it's new. So we don't have long-term data.
So if we take a look at the mechanism of action of the vaccine in the Pfizer document, it says the mod RNA in the Pfizer-BioNTech COVID-19 vaccine is formulated in lipid particles which enable delivery of RNA into the host cell to allow expression of the SARS-CoV antigen. The vaccine elicits an immune response to the S antigen which protects against COVID-19. So originally, I had thought this mRNA vaccine meant messenger RNA, but we can see here in the document it actually says mod RNA. So what is mod RNA? I'm not really too sure, but I just am showing you this screenshot just to kind of get a definition of it. This scientific journal published in Cold Spring Harbor Perspectives in Medicine, it defines mod RNA as chemically modified mRNA. So this is something that's not a naturally occurring type of RNA. It's a chemically modified RNA. So this mRNA doesn't stand for the typical messenger RNA. I just want to make that point.
Basically, the vaccine has in it a little piece of mRNA, which is genetic material that's able to code for certain genetic sequences. And it's encapsulated in this little lipid, like a fat envelope. So it's kind of mimicking the way viruses kind of work. So that's injected into the body and that envelope breaks down and the mRNA comes out and it's able to code for a spike protein that's located on the coronavirus. So it doesn't make the actual virus, it makes a spike protein that would be on the envelope of the coronavirus. So then the body recognizes that spike protein as foreign and it starts to give an immune response against that. So it's kind of taking a little piece of information from the outside of the coronavirus, putting it into the body artificially, and then making the body have an immune response to it, right? So that's the way it's worked. That's the idea behind it, and that's how it's supposed to be working. So like I said, there's no long-term data on it, because in order to have long-term data, you have to have a long term, which means you have to have a lot of years. And this just got, authorized, emergency use authorization not even a couple months ago. It's, yeah, maybe 2 months ago. So 2 months isn't a long time. So we need more time to be able to assess that. Like I said, there aren't any other vaccines about that. So here's something that I do want to bring up. So, and this is just kind of speculation. So there's something called molecular mimicry, right? So like in a disease like rheumatic fever, you have the germ that causes rheumatic fever and your body attacks that germ, but it can also attack your own body cells as well. Like your cardiac cells can be affected in rheumatic fever. So there's like this kind of concept of molecular mimicry that could happen. So, okay, having said that, there is something called endogenous retroviruses, right? So the human body has a lot going on. The skin has millions and billions of microorganisms living on the skin, and they're supposed to be there. They're part of the body's immune response. It's part of helping keep the body homeostasis. So same thing with the digestive system. Billions of microorganisms are living in there, and they're serving a purpose and they're serving a function. And they work together in a symbiotic relationship with the body. So now, if we're putting a vaccine that's mounting a response to a spike protein on a virus, there are things called endogenous retroviruses. So we have endogenous retroviruses in our body that are doing certain jobs in our body, and they kind of belong there. They're part of that microbiome that we're talking about here. So one of those is Syncytin-1. It's a endogenous retrovirus that's present, and it has a function in the placenta, right? So obviously you only have a placenta if you're a woman who's pregnant and going to have a baby. So this endogenous retrovirus is responsible for actions inside the placenta, and it can be related to when the baby is born, like the timing of the birth, and a couple of other things. So if the body had an immune response against the coronavirus antigen, and maybe if that virus had similarity to this endogenous retrovirus and the body killed that endogenous retrovirus, it wouldn't be present to do those functions it needs to do in the placenta. So I'm not saying I know this and this is, something that's been proven. There's no data, there's no research, but theoretically that could happen. And I think it's interesting to note that before COVID, the rate of stillbirth was 4 per 1,000. And then during COVID, the rate of stillbirth went up to 9 per 1,000. So I don't know if there's any correlation there. It could not be related to COVID at all. It's just those are the numbers. But that's just something to really kind of think about and, kind of consider that, since we don't know what the vaccine could do, we have to consider what are the potential possibilities of what it could do. If it's going to kill viruses, and that's what it's designed to do, it's designed to make us kill a virus, could it also kill important endogenous viruses in our body as well? It's something to consider. So with pregnancy, I feel that there is definitely an added level of protection and caution that's needed because it's a very unique biological process. One human being is growing a completely different other human being inside of it, right? That's something that's really kind of just a monumentous task for the body to undergo. So it requires a level of protection. It's really a sacred event that's happening, right? So I like to always err on the side of caution and just kind of think through and think about, what could be going on. So, and Pfizer seemed to have felt the same way about this level of protection over pregnant women, because with their study, in order to participate in it, when you came in to get to be assessed to see if you would be a candidate to be in the study, you had to have a pregnancy test if you were a female, right? So they were doing pregnancy tests on the females, and then anybody that was characterized as somebody of childbearing abilities, they had to sign a document where they had to pick out which contraceptive method they were going to choose. So it wasn't enough for them to just say, yeah, I want to be in the study, but don't worry, I won't get pregnant. They were like, no, you have to tell us what contraceptive method you're going to be using. Is it abstinence? Is it one A, B, C, or D? Pick one out. So, or two, I think it was pick two out. So they had these participants sign these documents, they're pregnancy testing them, and if anybody was pregnant, that was exclusion. You couldn't be in the study and be pregnant. So that's why we don't have any data about pregnant women, because Pfizer was excluding them from the study. Okay, so there's no data on this vaccine and what could be going on during pregnancy. So it's something to think about, not only if you're pregnant now, but even if you plan to be childbearing in the future. It's something to think about and talk to your doctor about and really kind of, investigate a little bit. ACOG, however, is recommending that pregnant women get the vaccine. ACOG is the American College of Obstetrics and Gynecology. They kind of develop like the guidelines for obstetrical care and prenatal care and things like that. So they're actually recommending that that the vaccine be given to pregnant women. However, without any data, I'm not sure how they came to that conclusion, why they're saying that, because even in Pfizer's clinician's guide, the Pfizer's clinician guideline says available data on Pfizer-BioNTech COVID-19 vaccine administered to pregnant women are insufficient to inform vaccine-associated risks in pregnancy. So they didn't have any pregnant women in the study, so I would say that's insufficient data. And that's what they're saying in their clinician's guidelines. So they don't have any data about the risks associated in pregnancy. So, without information, it's hard to make decisions. We need information to make decisions. So another tool that's actually pretty useful that I'd like to share with you is the National Vaccine Information Center. They have this little pamphlet that they provide, and it gives 8 questions that you can ask yourself and you can talk with your healthcare provider about before you get a vaccination. It's just another tool for gathering information. So it gives you those 8 questions, and you can kind of read through those, think about them, ask yourself those questions, do some research, talk to your healthcare provider, talk to other trusted people. Back in July, I was doing some research and I was reading about a group of Indian researchers that submitted a study that was withdrawn eventually. And this research was really kind of presenting that the coronavirus itself was not a naturally occurring virus, but it was a man-made virus. So there was also French virologist Luc-Antoine Montagnier. He won the Nobel Prize for discovering the HIV virus. And he said that the virus is man-made from HIV and a malaria parasite. So what he actually said was that this may likely have been a failed HIV vaccine attempt, the coronavirus. So what they're looking at the genome and the structure, the DNA structure of the virus, and they're forming a conclusion that it wasn't a naturally occurring virus due to this genome structure. They said that it had characteristics of gain of function and other lab technological terms that they use when they're doing genetic research and things like that. Also, a Norwegian scientist, Bergen Sorensen, and British oncologist Angus Dalgiesh also called COVID man-made, and they had published that in the Quarterly Review of Biophysics. And then there's another scientist. His name is Tasuku Hanjo, and he's a Japanese immunologist, and he got the Nobel Prize and many other awards for his achievements. He's been researching viruses for over 40 years. He says that COVID is not natural. That was his quote, not natural. It is completely artificial. He says this, and this is a quote, 100% confidence. And when a scientist says 100% confidence, it's actually pretty significant. So he says with 100% confidence that the coronavirus is not natural. And he says if this is false, if his claim turns out to be false, they can take away his Nobel Peace Prize either now or after he dies. So he was really confident in his assessment, and he wasn't the only one that had that assessment. So that was really interesting, because that adds another layer of question for us. So, okay, let's say it's not a natural virus, it's a man-made virus. What does that mean for the vaccine? So do we have any vaccines that are made to work against a man-made component? No, we don't, right? So if that were the case, and these scientists could be wrong, this could be, false information or just, misinformation. And it could be not an issue at all, but if it is an issue, it's something that we would want to think about. What are the implications for a vaccine that's made for something that's not natural, right? And this is there's all kinds of research being done, and some people who have never heard of something like that may be saying, oh, that's a conspiracy theorist. It can't be a man-made virus, but there can be. We have chimera, viral chimera, or even animal chimera, where it's basically you're taking one animal and genetically splicing it with another animal to produce different things. That they get a human hemoglobin that way, insulin. Different things are made where they can kind of splice human genes into animal genes to get different products. And they do it even with like agriculture and animals, and to get better cuts of beef, or whatever meat they're genetically manipulating. So it's not entirely this isn't like a science fiction thing. They really do genetic engineering. That's a thing. Now something like that with a virus, that's not just like in any old random lab, that would be in a biosafety level 4 lab, because anytime there's a risk of something going out and contaminating people, that would be, have to be done in a lab with a certain set of safety precautions and regulations and parameters of protocols for containing potential outbreaks and things like that. So a biosafety level 4 laboratory would be a place where that type of research could be done. So yeah, that's just some information, about potentially what we could be dealing with, and which questions should we be asking? Like, right, we're talking about getting this vaccine. Where should we start? Where should we even get information, right? Because there's so much. It kind of reminds me of the situation with thalidomide. So thalidomide was a drug that was invented in Germany. They came up with it. They said, here we go. This is going to be, a great drug. And it is still used for certain things today. I can't remember what, but they started prescribing it for women for morning sickness. The women that were having nausea and morning sickness, they gave them the thalidomide, and they thought it was going to be great, right? But what happened was, it was terrible. When the babies were born, many of them had terrible birth defects, deformities of the internal organs that affected their health. Deformities of the arms and the hands and the fingers, the legs, the feet, the toes. There were a lot of deformities that affected the baby's development, growth, their activities of daily living, and their ability to function. So it was really a serious situation where they thought it was going to be good to prescribe for this for morning sickness, but it turned out to be not good at all. So, it's one of those things that's a really clear, simple one when we're weighing risks and benefits, right? Do I want to have morning sickness? Do I want to have a baby potentially with, life-threatening and serious birth defects, right? So, I think most people would probably choose the morning sickness, right? So, it's kind of giving that example of like, they wouldn't have prescribed that if they knew that was going to happen, but they didn't know it was going to happen until it happened, right? So that's kind of, once they started gathering that information and they made the connection, there we go, so that's kind of where we're at. We're so early in the timeline here with the virus itself and with the vaccines, because everything's just happening in this like span of, less than 2 years. So it's not a lot of time for us to gather data and information.
The last point I want to make about risks is that there really are a lot of unknowns here in this area. The reason why is because the clinical trials aren't over. If the clinical trials were over, all the data was in, we'd be looking at FDA approvals, right? We're not looking at FDA approvals right now. We have an emergency use authorization. And the clinical trials are still ongoing. They're still going on. And if we look at the Pfizer document, it says right here, I have it circled in blue, additional adverse reactions, some of which may be serious, may become apparent with more widespread use of the Pfizer-BioNTech COVID-19 vaccine. So here they're telling us we don't have all the data in, so we're really not sure what other adverse reactions there may be, but we'll probably find out once we start using it more on the public. And that's kind of what we're looking at here.
Yeah, there's a lot of difficulties with this, doing research, and it's science and it's life and it's complicated. Back when they were trying to develop a vaccine for syphilis, they coined this little phrase, graviora cadem sunt remedia periculus. And it's a Latin, and it means some remedies are worse than the disease, right? So, and I'm not saying that about the COVID, but I'm just saying this has been an experience in the past as well, with different things where they said, oh boy, this didn't turn out the way we wanted it to. All right, so let's talk about what we did benefits, we did risks, so we're up to A, we're up to alternatives. So what else could we do besides get the vaccine? Well, we could take care of our natural immunity, and that would be a whole separate podcast to talk about how to do that. That's a lot. So we could take care of our immunity and just rely on that. We could get COVID, and we could get sick and we could die, right? That's a risk associated with an alternative. We could get COVID, we can get sick or not sick, and we can develop immunity. Right? So we could have our natural immunity. So let's talk a minute about natural immunity, because this is a question people have. Well, if I already got COVID, should I get the vaccine? So, and this is basic information that everybody that is in the medical field has learned at some point. The immune system works by being exposed to something that's not itself, right? The body has this ability to recognize cells that are not self. So, and those things are called an antigen. So the body gets exposed to an antigen, and then a whole complex series of things starts happening. But the one thing we're going to focus on here is the antibodies. So the body starts making antibodies against the antigen, right? That's what's building up, and that's when this is happening, it's the IgM antibodies that are starting to build first. And so that's what they kind of test with in those rapid tests. They're looking for those IgM antibodies. But then as time is going on a little bit, you start to develop these IgG antibodies, and those will remain in the blood for a specific amount of time. And that's what, people are saying, oh, should I get tested to see if I'm immune? Oh, and if you have the IgG antibodies, they're thinking, yes, I'm immune. However, that could be a little confusing, because if you don't have the antibodies, that doesn't necessarily mean you're not immune. Because remember I said in that initial process where the body's recognizing the antigen and it's making the antibodies? Well, what happens during that process is certain cells called memory B cells and memory T cells, they retain an actual memory of that process for that specific antigen. So that means that later on, if the body's exposed to that same antigen again, those memory cells will then be activated and can then begin producing that same antibody. And this time, it's not going to take that lag amount of time, right? Like we see that people are getting the first dose of the COVID vaccine and then they're getting sick because their body didn't have enough time to get up to that level where the antibodies could overwhelm it. However, with the anamnesic response, it doesn't take that amount of time because it already has the memory. So the second response is going to be much quicker. It's going to be faster. It's going to be stronger. It's going to be more overwhelming. So just because you don't have the antibody in your body, detectable in your blood, that doesn't mean you don't have those memory B and T cells, to be able to mount that immune response a second time. That's the way the body is designed. This is the whole concept of a booster shot, right? A booster shot says, hey, do you still have immunity to this? Okay, we're going to give you a little bit of the antigen. And your body says, yeah, I remember that. Boom, it starts making the antibodies. And now you have titers, right? So we've known about this for forever. Not forever, but you know what I mean? That this is the way the immune system works. So you don't necessarily have to have these detectable IgG antibodies in your blood to be considered immune, because you have those B and T memory cells that have that memory and are able to create those antibodies in real time, in the present, at that moment that you're being re-exposed.
I put an asterisk next to the word anamnestic response because I think it helps to understand what that actually means if you know what that word means. So it comes from the Greek word anamnesis, and that word literally means to take something from the past and recreate it in real time in the present moment. So it doesn't mean remembrance. It's used one time in the Bible and they translate it remembrance because there's no other word in English, but it really means to take that thing from the past, bring it into the future in reality, make it actually present in reality. So that's what's happening with those cells, those memory B and T cells. They retain a genetic memory so that they can actually recreate those antibodies in real time when they're needed. So I think it's just a little interesting to know that word anamnesis and what it means and how it relates to immunity.
Okay, so I hope that makes sense about the immune system and how it works. With the chickenpox vaccine came out, the assessment would be, have you had the chickenpox before? Oh, you have? Okay, you don't need the vaccine because you have natural immunity, right? We can get immunity naturally or artificially. So, if you've had the sickness, you have natural immunity. If you've had the vaccination, you have artificial immunity. So, just another thing to consider, with the alternatives. So let's go on now to intuition. So what does my intuition say about this? And this is important. This shouldn't be overlooked. So some people that are really intellectual and really analytical, they're just like, that's not even on the table. Intuition's not part of it. We're not going to consider that. And that isn't good because we as people, we're not just physical beings, right? We're physical. We have emotions. We have our mind. We have our soul. We have our spiritual life. We have different dimensions that are all kind of together. And this is actually something that's really important. Maybe I would do another podcast on this because it really affects and impacts health. Just being able to understand that. So we can't just go and make all our decisions based on emotion, right? That's not going to lead us in a good direction, and we can't just base them completely on thought either, because sometimes something seems really logical, but there's just a check in our spirit where we're like, I don't know, something's not right with this, something's wrong, and then we investigate it a little further, and then we find out some information, right? So. It's good for us to consider this and keep a balance between, making our decisions based on just information and fact and making our decision just on emotion. We have to kind of meld the two because we're melded together in that way as human beings, right? We're not just thinking analytical robots. We have feelings and thoughts and emotions, and we have souls. So the two things should be also considered, right? So, and my feeling is that, when a patient has a concern, that's a valid concern. It may not be my concern. It may not be the other healthcare member team's concern, but it doesn't matter because it's the patient's concern. So therefore, it's a valid concern. So all concerns should really be considered. So how you ever had a teacher that said, no question is a stupid question. Then you do feel more comfortable to actually ask the questions, and then you feel like you're learning more. I think it's the same thing with this situation in healthcare in general, really, that, people shouldn't be afraid to bring forward their concerns because they should be able to express that, discuss that, bring that information forward. This is how we can, educate, inform, overcome obstacles, come to an understanding. It really creates an environment that's more conducive to people being engaged in their healthcare, making their own informed decisions, So I think that's really important. So, because the fact is that the patient or you yourself or me myself, we have to live with that decision for the rest of our lives, right? Whatever health decision we make, if it's taking out your gallbladder, getting your tooth pulled, having a treatment, an experimental treatment, taking a vaccine, whatever it is, you have to live with that decision for the rest of your life, not the person, the healthcare provider or anybody else. So that's why it's so important. Because for you to be able to make your own healthcare decisions, because it's you and it's your life, you should have that autonomy over your own body. The people say, my body, my choice. And it's true. It is your body. It is your choice. So I think, I I do want to discuss this. I have a concern about this because I think if we're placing biases on people and we're projecting our thoughts onto other people, it has a tendency to create a dichotomous situation where there's conflicts, right? And that kind of conflict and situation will create inequity in healthcare. And that's not what we want, right? The goal is to have equitable healthcare. So this term anti-vaxxer, I hear this term a lot. And this term, I believe it will unfairly categorize people into a group where, you're the anti-vaxxer, so you're over here in this group. So that puts everybody else into this category of they're not anti-vaxxers. So now we have two groups that are potentially, diametrically opposed to each other and creating this situation where there's conflict, there's friction, and there's, just an imbalance, and that imbalance can create inequity. So I really don't think it adds anything to the conversation to create these labels and unfairly categorize and stereotype and put people into these boxes. And then, you do have people in the middle. So they're wondering, where do I fit in? I'm in the middle. Maybe somebody is saying to themselves, I wouldn't mind having a vaccine that's, just a weakened virus that's going to spur my immune system. But you know what? I'm cautious about taking a virus that has certain characteristics, So maybe they're a person that takes a certain vaccine and doesn't take another one. And so where do they fall into these groups? So when we're creating these groups, it's not a fair way we shouldn't be labeling people because everybody's different. Everybody has a different situation. They have different lifestyle. Maybe somebody, barely leaves their house and isn't around a lot of people and isn't really concerned about, being immune to a communicable disease, or, maybe somebody has a lot of health issues going on. The Pfizer document says in here that if somebody's immunocompromised, they may not be able to generate a response. We shouldn't project our thoughts onto other people. We shouldn't project our, views on something onto other people, right? So I've had situations where, a patient has cancer and the medical team comes up with a treatment regimen and presents that to the patient, and the patient's fully informed, fully educated. They understand the risks, they understand the benefits, they have all the information. And we're thinking, okay, they're going to go ahead and go with the treatment and go on, but they don't. They say no, they don't want to. They refuse the treatment, and that maybe that's not our choice, and that's not what we would recommend, and that's not what we're wanting. However, that's their choice, and even if we don't agree with it, we still need to respect it, and really kind of make sure they really understand and make sure this is an informed consent. And when we know it is, then we respect it and we accept it and we move on. So, help really isn't help unless it's wanted, right? So you think you're helping somebody. Oh, you have cancer, you're going to die. I'm going to help you by forcing you to do A, B, and C. That when you're forcing somebody, you're totally overlooking their right to have autonomy over their body and their free will and, their ability to direct their own life. So, example could be, somebody's homeless, like let's say there's a veteran with PTSD and he's homeless, he lives on the streets. You could be going up to him and saying, oh, I'm going to put you in a shelter and you're going to be better off there. But for him, he's thinking, I can't be inside four walls. I need to be outside. This is where I feel comfortable. You don't know where I'm at. You don't know what I'm thinking, and, if I'm inside, it increases my anxiety. The benefits of the amenities of a home and the luxuries of a home those benefits do not outweigh the risk for me because I need to be outside where, I'm feeling safe. Maybe we don't understand that. Maybe we don't know where they're coming from. We don't know where they're at. Their mindset is something we can't comprehend. So, we have to respect that and say, okay, I wanted to put you in a shelter because I thought it was helping you, but you're telling me that's not help, that where you're at is where you want to be. I need to accept that because help is not help if it's not wanted. Okay, so I think that's important for us to really remember, and people might even bring in like, oh, it's for the greater good because we don't want homeless people laying around, and it looks bad for the neighborhood. It has to be for the greater good of the community, and the same thing, with vaccines. It's for the greater good, and you're gonna be killing your neighbor. You're responsible for other people's deaths if you're not vaccinating yourself. this is really kind of flawed logic, because again, it violates people's free will. And anytime we're overtaking control of another person's life in a serious way like that, we really need to consider it seriously and carefully, because it's an egregious thing to take someone else's freedom away. So, and I know a lot of people, especially in public health, don't agree with that. But you know what? If you're the one person that's getting your freedom taken away, you're going to be really kind of thinking about that. Just like if you're the the 1% that dies, you're gonna be the one that's really thinking about it. So, I think it's only fair for us to consider the marginalized and the smaller minority of people that would be affected. Back in November, the New York State Bar Association passed a resolution urging the New York State to consider making the vaccine mandatory for all New Yorkers, even if they object for religious, philosophical, or personal reasons. So, that really is concerning. New York State has already passed a law that doesn't allow parents to make any exceptions to vaccinations for any reason. So, this is really, we want to empower people. And what laws like this do is disempower people and make them, really just having no autonomy over themselves. We also have this proposed law, BA 11179, from Linda Rosenthal in Manhattan, who says she wants to add a new section to the public health law that permits the state to mandate vaccine if it is determined that not enough people are getting the vaccine to establish herd immunity. And she has determined that she thinks herd immunity is 75 to 80%. So, this is not a good direction to go in. And as someone in public health, I don't support that. So let's talk about this term, vaccine hesitancy. This is a term I'm seeing a lot flying around in the medical literature. I even have a definition of it here and a framework for exploring it. This is for healthcare providers. So this term, vaccine hesitancy, so it really assumes that the only choice is to accept the vaccine, right? So why would you be vaccine hesitant, right? It assumes that the right thing to do and the correct action is to accept the vaccine. So if you're hesitant about it, you need to move towards acceptance. So, and like I said, the World Health Organization considers vaccine hesitancy as one of its top 10 global health threats of 2019. So this kind of messaging, it really creates kind of a feeling of pressuring people. So I think it's going to have more of the opposite effect that they intend. So if you're telling people, vaccine hesitancy, we need to combat this, and this is a global health threat, you're basically telling them you need to accept it, right? So that is kind of threatening to people, and that puts people in a position where they're feeling like a little bit on the defense and defensive, right? So I don't think it adds anything helpful. And I actually was thinking that vaccine hesitancy meant that people didn't want to get the vaccine because they hadn't done the whole information gathering process yet, that they're still trying to get information, trying to talk to their healthcare provider, and they're still figuring it out, what they're going to do. So that's what I thought vaccine hesitancy meant. However, there was an actual definition in one of the medical journals, and they defined vaccine hesitancy as a delay in acceptance or refusal of vaccine despite availability of vaccine service. So it actually didn't have anything to do with, gathering information and making an informed consent, an informed decision. It just had to do with you didn't want it because it was there. So I thought that was a really weird definition, but that was a definition that they had. They also have this framework for exploring attitudes towards COVID-19, and it kind of goes down this list of things that you should be asking, and you kind of rate the person and score their vaccine hesitancy, and that could be a useful tool. All right, so vaccine hesitancy. the number one group that seems to be labeled as vaccine hesitant is Christian people and Blacks. So Blacks have been labeled as vaccine hesitant. And I've seen some stuff, oh, it's because of the Tuskegee experiment that happened in the past, it's over, everything is fine now, we need to move on. So let's just explore that a little bit because it is a concern, and people are talking about that. So we have Jerome Adams, Jerome Adams is the Surgeon General, and he had been going around and visiting Black churches and talking to them about the COVID vaccine. So this was something, he was traveling all over the country to go into churches and talk about the vaccine. So I found this interesting quote from a man named Murthy. He was a former Surgeon General, and he said that we need to send messengers, that was a quote from him, we need to send messengers into the Black community to increase, and this is a quote also, this is a quote, to increase buy-in for a COVID-19 vaccine among African Americans. People are not always going to trust us, but they might trust the church. Okay, so he was talking about using this technique of going into churches to deliver messaging to the Black population to change their thoughts and their, what their perception was. Okay, so this is not, and like I said, this is currently now with the COVID vaccine, the Surgeon General Jerome Adams was going around to Black churches to deliver that messaging as well. So this is not a new technique. This has actually been done before. And I want to share a little bit with you about that. So back in the early 1900s, a lot of people were into like this eugenics movement. It was basically like a theory that said, we can have racial purity, and we can the Aryan race is supreme, and we can purify the bloodlines to improve humanity for the greater good of humanity. We can just get a better race of people if certain people don't reproduce and certain people do. So they wanted to get rid of like the poor and inferior people. So they did include Black people in inferior people. So this eugenics movement, one of the ways that they wanted to do this, I mean, you do have the example of like, Hitler and the Holocaust were just like mass slaughtering of people. But they had other modalities as well where it wasn't that extreme. It was more, subtle to interweave into society without causing a historic upset. So birth control and abortion were the methods that they wanted to use to help decrease certain amounts of population that they didn't want, that they felt wasn't good for the greater good and it wasn't good for humanity. So they established the American Birth Control League, and they really worked hard, and they tried to put these methods out there and educate people. They would talk about, spacing your children to make sure that, you weren't having too many children at one time, because if you didn't have the money to afford them, you couldn't support them. So matching the number of children you had with your financial capability became a big message for them. And then pushing, birth control and setting up birth control clinics, and also, eventually abortion as well. And again, that's someone's choice. To birth control, that's their choice. Abortion, that's their choice. So this American Birth Control League, who ended up changing their name to Birth Control Federation of America, they developed a project called the Negro Project. And this was where they were going to their plan was to decrease the population of Black people. And they were actually going to use Black people to help them do it. So what they did was they appealed to them and said, went to like certain leaders, academic leaders, church leaders, and went to them and said, we want you to be a part of this. It's to help the Black community because you guys are having these struggles, and this is how we're going to help you. So they had this beautiful cover story of how they were going to be so helpful in, helping the community, the Black community, by giving them birth control and giving them abortion. but they were eugenicists that wanted to manipulate the population so that they could create a supreme pure Aryan race, right? So they had set up a clinic in Harlem, and this clinic was, birth control, I believe abortions as well. And they went into the Black churches in that community, and they would educate on their what they were doing in this clinic and developing the relationship between the community and the clinic, and they would even have guest speakers, and they would have the pastors themselves speaking about it. So this is what they were doing, and let me see here, because I do have a quote. The people at this movement, they knew that Black people were religious people, and they knew that they wanted to incorporate the churches in their project. So this quote says, "The minister's work is also important, and he should be trained, perhaps by the Federation," that's this Birth Control Federation of America, "perhaps by the Federation, as to our ideals and the goal that we hope to reach. We do not want word to go out that we want to exterminate the Negro population, and the minister is the man who can straighten out that idea if it ever occurs to any of their more rebellious members." This is a direct quote. This is from a website called concernedwomen.org, and they give a really good explanation of this whole process. So there was another quote here too. Hold on. So believe it or not, they were actually kind of partnering up with Clarence J. Gamble of Procter & Gamble. And Gamble was saying that the Black leaders might catch on and think that this birth control plan was an extermination plot. So he suggested that they place Black leaders in positions where it appears that they're in charge. And so the response is that, this is a quote, I note that you doubt it worthwhile to employ a full-time Negro physician. It seems to me from my experience that while the colored Negroes have a great respect for white doctors, they can get closer to their own members and more or less lay their cards on the table, which means their ignorance, superstitions, and doubts. They do not do this with white people, and if we can train the Negro doctor at the clinic, he can go among them with enthusiasm, knowledge, which will have far-reaching results among the colored people. So she's kind of saying, what they're saying here is that Black people aren't as likely to display their ignorance, superstition, and doubts in front of white people. So they want to kind of train the Black doctors to not do that. Like they feel like once, the Black doctors get with their Black patients, they'll kind of be like on the down low, hey, here's some information. But they're kind of saying, we're going to train them not to do that and just basically have them promote our agenda. So there's some interesting things there. So, if people, is this not a conspiracy theory where people are saying, the Black population has vaccine hesitancy because of things that have happened in the past? Like we know about the Tuskegee experiment, that's been all over the news, and, that's kind of, but this here, does relate to what we're talking about, because there was this underlying thing that was presented as something else, right? So they had this basically extermination plot going on, but they were presenting it as this is for your benefit, this is for your help. So if you were a part of that, you would be very distrusting as well. So if we fast forward to today, 2021 in New York, where I do live, the truth and the fact is that in New York City, more Black babies are aborted than born alive. So it makes you think that their plan is still in place. And in fact, this Birth Control Federation of America does still exist. Their name is actually Planned Parenthood. They changed their name to Planned Parenthood, I forgot what year, but they're still in existence. It's the same company. And maybe maybe they were successful in their plan because those statistics are real statistics. That more Black babies are aborted than born alive in New York City. So it is something to consider. I'm not saying the coronavirus vaccine is a plan to exterminate black people, but what I am saying is that there has been a plan to do that before, so if I was a person that was in a situation like that, I would probably be thinking the same thing. And then we do have, Jerome Adams going out into the churches. So it really does make you wonder, like, do they really care about the black population and really believe that they're trying to make them safe and protect them? That could definitely be the case. Or it could be something else, right? Like I said, with that Tuskegee experiment, like that's all out in the open. Everybody knew about it. It went to court. They had a lawsuit. They made reparations. So everybody's kind of knows about that. But in my own experience, I've seen different things along the way, like over the years, different studies where I've looked at it and been like, wait a second, what? Like, that doesn't seem right. Like, I'll just give you one quick example. That was reading about one study where they were actually, it was a really unique situation where these women had natural immunity to HIV. And so they wanted to study them. So they were doing this study in Kenya, and these women happened to be sex workers. So they were having sex with multiple men a day, unprotected sex with multiple men a day for many days out of the week. And they were not contracting HIV. They were immune to it. So they were studying them. So, on the superficial level, okay, that's very interesting research. We want to know, how could they have this immunity naturally? This is very interesting. Let's research this. Let's find this out. However, sex workers, that's, take a step back and think about that. I don't think this woman's showing up to work in her 500 series Mercedes-Benz with her Christian Louboutin shoes on. Her kids are in private school, husband's at work, 401k is doing great. She's loving life, showing up to work, ready to go. She's a victim of sex trafficking and she's being prostituted. And this is, we need to assess the situation. Does she need help getting out of this? Is this really what she wants to do? Because somehow I'm doubting that, so it's just a little interesting. The research is presented as, yeah, we did research on sex workers. Oh, you did? Really? Well, what happened to them? Where did you leave them at? What's happening with them now? So things like that just can be questionable. Another one that I think is very interesting and actually really ties into the vaccines is the case of Henrietta Lacks. So Henrietta was a black woman from the South, and she was of low socioeconomic status, and she ended up getting cancer and going to Johns Hopkins University, where they had a research lab and they were doing research. And in order to do research, you know the word in vitro, where they're doing studies in glass in petri dishes. In order to do that, you need to have, a lot of times for different research, you need to have cells. And those cells have to be alive and they have to be multiplying and they have to be continuously multiplying so you can observe and see what the effects are. So most cells, they have a lifespan, right? Your skin cells die off and then you get new skin cells. Like most cells are pre-programmed to die after a certain number of divisions. However, there are immortal cells that don't die. They just keep going and going and going and going. And if you're a researcher, this is great. This is what you want, to be able to just have those cells that keep going and going. So Henrietta, she's got cancer. She goes to Johns Hopkins. The researchers there end up taking some of her cells and realizing that her cells are just keeping dividing. And they're great for their research. And this is, what they were hoping for and needed. So, you could look at that as like Henrietta contributed to the advancements of science and, she did a great service for the greater good of humanity. However, the Henrietta's cells, okay, I know there's a book about this and there's a movie. I never watched the movie or read the book, but I know about her cells because they're all over the research. Or they're in. I think Johns Hopkins was working on the polio vaccine. Don't quote me on that. It might not have been that, but I think it was the polio vaccine. I think Henrietta's cells are in it. But these companies, Henrietta's cells, 50 million tons of her cells have been produced, and they're still being produced. They're still being used. Her cells are still out there. So a lot of people, a lot of companies made a lot of money off of her cells. However, Henrietta died a poor woman. I think she's like in an unmarked grave. Her family got no money. They got nothing from this. They did not profit off it at all. Matter of fact, Henrietta never gave informed consent. She was not told that this was what was going on. Her family found out about this stuff later on, and you have a family member that dies, you want them to be laid to rest with dignity, you want closure. There's certain things that people do value in the death process there. With Henrietta, her cells are all over the place. Her they even put her cells in outer space. Her cells are in outer space. So her family's over here thinking like, what happened to my mom? What did they hurt her when they took the cells? Were they torturing her? Did she have pain? What happened to her? Are they cloning her? All her cells are multiplying. What's going on? They have no closure. They have a lot of unanswered questions. They didn't benefit financially off of it. So, there was a risk there for them, but no benefit, so that's a situation that would really create some distrust, just because it really kind of leaves so many unanswered questions. Why did that happen? And why wasn't it done ethically, if it was going to be done at all? Okay, so Henrietta's cells are one example of immortal cell lines. There are other immortal cell lines as well, and they're very useful in research, like I said. So there are other animals that have been had cells created for immortal cell lines. There's also insects that are immortal cell lines, as well as, and this is in the next concern that I wanted to talk about. A lot of people have brought up the concern about vaccines containing the cells of aborted babies. And I've heard some people say, no, that's a conspiracy theory. No, it's not a conspiracy theory. That's real. Many cell lines are many immortal cell lines are from aborted babies. That's been a common practice in research for a long time, since I think the 60s and 70s, maybe even before that. So just to kind of, and this is important information. So some people, for them, if this is a concern for them, this is information they should have before they engage in a vaccine, right? If you're buying cosmetics, you can easily look at the packaging to see if it's vegan, to see if it's animal cruelty free, to see if it had any animal testing. So because that's important to you, that the health and safety of animals when you're buying your cosmetics, you can get that information to inform you on your purchase decisions, right? So it should be even that much more important for our healthcare decisions for us to have that kind of information, before we take a vaccine. If you're concerned about, animal cells or insect cells, aborted fetal cells, or Henrietta's cells, this is information that you should be able to have. Let's talk a little bit about the aborted cells. So it's not a situation. So these are immortal cell lines. So once they take the cells out of the baby, the cells are going to continue to multiply sort of indefinitely. So it's not like they have to keep harvesting aborted babies to keep getting the cells. So there's not this continuous harvesting of babies that we know of. They are a lot. Like I said, a lot of these lines have been in use 60s, 70s, 80s. However, it does raise a question. Well, how did they get the cells from the babies? What were they doing to the babies? Because what I do know from just knowing about genetic research, and when they're doing, like, let's say when they're creating transgenic animals, what they'll do is they'll take the embryo of that animal and they'll splice in a gene from another animal with a pulse of electric energy. That gene will then be spliced in. And they're doing it at the embryo stage because the embryo has the stem cells. So a stem cell is kind of like a base model cell that can go into any different form. It's not already a skin cell. It's not already a bone cell. It's not already a nerve cell, right? So the stem cells are kind of like that base model where you can manipulate it and make it do whatever you want. So that's why those stem cells are valued for scientific research, because when they want to manipulate the cells, those ones work. So they use eggs. They use eggs, but what they'll do is they'll take an egg of a bird, right? A bird like a chicken, duck, whatever bird egg, and there's actually a baby bird inside of it, right? So they'll be manipulating that baby bird and experimenting on that baby bird. Let's say they're testing a new vaccine, and they inject it into this embryo that's in the egg, and they can actually, like, using certain techniques, observe what's going on in there. It's like a perfect little scientific observation model for them. So they'll be documenting, like, embryonic necrosis of digestive tissue noted, or delayed development of neural system noted, and whatever they're documenting, heart rate of the embryo decreased, or they'll be documenting it, and then finally it dies, and they document when it dies. So they have this embryo that they're experimenting on, and they're documenting all of those changes. So they do that with the birds. That's a known technique. So it's possible, I haven't really ever researched this, but it's possible this is what they're doing with the human baby embryos as well, because they are using their cells. So if we need to use cells from something, those cells have to be alive, right? A cell, in order for a cell to divide, it has to be alive, right? So logic would just conclude that these cells are harvested from the babies when they're alive. If you want live cells, that would be the best way to get them. So, we know that the babies didn't survive the procedure. The babies are dead, right? So, it does make us question if this is a concern, what happened to these babies, and what was going on. Also, some of the vaccines don't contain the cells of aborted babies in the vaccine. They'll just use those cells during the research and development part. So, and the Pfizer and the Moderna vaccine, they both used the cells of aborted babies to help them do the research and development to make the vaccine, but they don't put the cells in the actual vaccine. And like I said, this isn't a new thing. The rabies vaccine, shingles, MMR, they have aborted cells. So, okay, so I have a document, actually. The Charlotte Lozier Institute puts out this guide. It's actually pretty helpful. I was glad that I found it, because I had a lot of research all pieced together, but this kind of included everything all in one place. So it's a very nice document to have. So just give you a little rundown here. The Sinovac vaccine uses the HEK293 cells in its testing, in its confirmatory lab test. So it's not in the actual vaccine, but they use it for their testing. And HEK293 is one of the names for, like, Henrietta's cells are HELA cells. This baby's cells are called HEK293. PER.6.C6 is another name of another baby's cells. And this is the Altimmune. So they use it in production of the vaccine, development, and their lab tests. AstraZeneca, same thing. They have the baby HEK293 in their production, development, and lab testing. The CanSino vaccine out of China, that one also uses in all three. Same thing as AstraZeneca. Gamaleya Research Institute out of Russia, they also, in all three categories, use baby HEK293. Immunity Bio and Nantk West, I haven't heard of this one. Immunity Bio and Nantk West, they're an American company that uses a derivative of HEK293 cells in their production, development, and lab testing. The Pasteur and Merck out of USA and France, they are using the HEK cells in their development, but not in their production. Johnson & Johnson, that one uses the baby PER.C6 cells in its development, production, and lab testing. This document is interesting too if you're concerned about animal cells. So it tells you which vaccines are using monkey cells, which vaccines are using hamster cells. and things like that. So we have the Vax Art, that's also aborted fetal cells in all 3 stages. This Longcom, that uses aborted fetal cells. Clover uses it in their lab testing. Novavax and Medicago also use it in their lab testing. University of Pittsburgh using aborted fetal cells in all 3 phases. Moderna used it in their lab testing. Pfizer uses it in their lab testing. The Sanofi uses it in their lab testing, as well as Inovio uses it in their lab testing. So that's just some information. I'll post a link to that document if you want to review that in your information gathering process. And the last point I'll make about vaccine hesitancy is that back in July, I had noted that there was a congressional hearing where 5 drug companies testified to Congress that the government needs to take action on the phenomenon of vaccine hesitancy. Okay, so these 5 representatives from different drug companies each approached Congress with a different take on what needed to be done about the phenomenon of vaccine hesitancy. So the representative from Merck, their position was that we should really be focusing on doctors, and that doctors should be promoting the vaccine and increasing awareness about the vaccine and things like that. Johnson & Johnson was there. Their representative said that we need to focus on education campaigns and educating the public and working with global authorities. AstraZeneca was also represented in this congressional hearing, and they had recommended that the FDA needs to tell people that the vaccine is safe, right? So obviously it can't do that unless it really knows that. So, but that was AstraZeneca's recommendation. And during this congressional hearing, one of the senators had asked the representative from Johnson & Johnson, you know, how can this vaccine be safe if it's been developed so quickly? And a lot of other people have this concern too. You know, the name warp speed is really probably not cars, yeah, warp speed, great. But, you know, for your development of vaccines, not the greatest name to have. You know, it's not really something you want to just be rushed through. We want to really make sure this is being done well and being done correctly. So the senator asked, you know, he asked this question, you know, how can we be sure it's safe? It was developed so quick. So the guy from Johnson & Johnson, he said, there may be a need to perform post-marketing surveillance, and we're working on a plan there. So he's basically saying, yeah, you know, we're going to put it out to the public and we'll figure out, like, you know, what to do after the fact. So, you know, that's information that kind of ties in with this vaccine hesitancy. Another concern that people raise is about where is this vaccine from, right? So consumers are more conscientious nowadays about where their ingredients are sourced from, you know, how are things made ethically and things like that. So I think it's a good question to ask where the vaccine is from. So if you kind of think about it, like if you were going to make dinner, right? Let's say you're going to make chicken parmesan and some salad, and you go to your local butcher and you go to your farmer's market and you're gathering up your ingredients to make the dinner. If something goes wrong, if somebody gets sick, or if one of the ingredients is no good, then you know that you can go back to that farmer or that butcher and have a conversation with them, and that they know their fields, they know where they got the meat from, they can actually go out and investigate, and you have that relationship with them that you can investigate this and you can get that information. You have the channels for recourse if something, you know, were to go wrong, right? So it's important, that relationship and that ability to connect and be able to investigate. So if you were to go, let's say, you know, not to knock Walmart, but let's say you went to Walmart and you got just a frozen chicken parm dinner that was like made in China, right? And you got home and something happened, it was no good, or somebody got sick, you know, you could go back to Walmart, you could get your money back probably, you know, but that doesn't help, you know, that doesn't help you investigate what was going on and get more information and kind of resolve the situation. So, you know, there's that need to kind of know where these things are coming from, where they sourced from, and I think that's important information to know. Again, this Charlotte Lozier document does indicate which country the vaccines are originating from and the names of the companies, and you can do research into those if you need that level of information. People have raised concerns, just kind of about the history repeating itself. Like we talked about the history of Black people being treated unfairly and unethically, inequity in the healthcare there. And there have been situations like that in the past, as well. Like in World War II, where they were using drugs on soldiers to increase, their stamina or their abilities. So and this isn't to say the German companies are bad, but there is a history there of things going in a bad direction. Some of these drug companies that were involved in World War II that were involved in changing behaviors of soldiers. You have Joseph Mengele doing unethical research on people that did not consent to be part of the research. And some of these companies were tied in and kind of played a role in that kind of abuse. So, that kind of historical thing does make people be a little more consumer conscious of looking at who are these companies, where are they coming from, and what are their ties, and what are the connections here. We're needing here in America 200 million doses. That's a lot of vaccine. It's a lot of production. So there's going to be people making these vaccines. Who are the people? How is it being done? This kind of ties into the next concern that I've heard people raise. People have said, I don't want to be involved with this vaccine, or I'm concerned about the vaccine because of Bill Gates's involvement.
Some people have raised a concern about Bill Gates and this microchipping of people. So you probably heard of this website called Reddit. They do this thing on there sometimes where people will say, AMA, ask me anything about whatever. So apparently Bill Gates went on one day and said, I'm Bill Gates, co-chair of the Bill and Melinda Gates Foundation, AMA about COVID-19. So he's saying, ask me anything about COVID-19. So people started asking him some questions, and there were a conversation going back and forth, right? And so Bill Gates, and again, it looks like it's a verified account. I'm actually a social media dropout, so I don't know everything about the social media, but it looks like it's Bill Gates. He says, eventually we'll have some digital certificates to show who's recovered or who's been tested recently, or when we have a vaccine, who has received it. So then people start commenting like, digital certificates, what is that going to be? And then somebody else comments and says, no, he's saying Microsoft and MIT developed tattoo markers that show whether you have received a vaccine or not. This will be coupled with Gates's new invention, ID 2020, which is a digital ID microchip implanted under the skin. And then it includes a link to this article at Science Alert that apparently talks about invisible quantum dot tattoo is being suggested to ID vaccinated kids. So sounds kind of like part science fiction, part horror movie. So it is something that's out there and being talked about. You'd have to do some research on that that could probably be its own separate podcast, because it's pretty deep rabbit hole potentially there.
So there is a quote out there from Bill Gates where he's talking about the need to decrease the carbon footprint for the greater good of the planet, and that he talks about in that it's a TED Talk, and I read the transcript of the whole TED Talk, and it says, he's talking about using vaccination, healthcare, and reproductive healthcare as a means to decrease population, which in itself is weird because that doesn't really make any sense. In the past, vaccines have helped to increase lifespan and decrease morbidity and mortality, with like polio and smallpox and things like that. So if you want to decrease the population and you're talking about the ways you're going to do it is, vaccines and healthcare, it just seems a little counterintuitive. So but the part about that TED Talk that I thought was really interesting was that in Bill Gates's mind, you could see as he's talking that he categorizes people into two groups of people, us and them. He refers to himself and I don't know, other billionaire people. I don't know who's us, but he refers to us and then he refers to them and he talks about, their agriculture and their farms. And so in his mind, he really clearly separates people into two categories. So it makes you really question, well, if he is talking about reducing the population, which group is he talking about, us or them? He really did say those things. So that's that. That you could just go and look up that TED Talk and make of it whatever you think you want to make of it. But then the question is, okay, but all right, he said that he makes computers and stuff. He doesn't make vaccines, right? So should we even be concerned? Is he actually tied to the vaccine? So I was looking into this a little bit. I did come up with this fact, actually. I shouldn't say fact. I read this in an article. It may or may not be true, but it states that the Bill Gates Foundation purchased $55 million in BioNTech stock in 2019. And that was before the coronavirus came out that he purchased the stock. And when I looked it up on my stock app, the stock opened in 2019 at $16.50. And it went up to, when I checked it the other day, it was $115.40. So I don't know what he cashed in or, I don't know what the deal is, but basically it went up $100 a stock and he bought 55 million. So that would mean he would have made $5.5 billion on the stock potentially. Could have. So that kind of says, well, okay, Bill Gates said something about population. And then we see that potentially he may have a financial gain, a financial investment here. So we have, he talked about population control and vaccines in the same sentence, pretty much, same paragraph. So there's this ideological concept that he's promoting or that he has. And then we have potentially a financial interest that he may have because of this stock purchase, if that's even true. But that doesn't mean he's connected to the vaccine in any way, right? So if we do a little bit further research, we've got a couple of organizations here. So we know the Bill and Melinda Gates Foundation is tied to Bill Gates, right? His name's right in there. However, there's also another organization called CEPI. So CEPI stands for Coalition for Epidemic Preparedness Innovations. And it was founded by Bill and Melinda Gates in Switzerland. And now this organization has given funding to a lot of the vaccine manufacturing companies. So they funded Clover, CureVac, Novavax, Merck. Let's see, they've funded Inovio. And AstraZeneca. Okay, so this CEPI has given a lot of money to $383 million they gave to AstraZeneca, for example. So, this is, even though it doesn't say Bill Gates' name in the title, this CEPI organization is tied to Bill Gates. So there's a connection there. Then you have this organization called Gavi, Gavi. It stands for Global Vaccine Alliance. It was created in 2000, and it has a 28-member supreme governing body, it's called, and it has different people represented on that governing body, CDC officials, a Rockefeller Foundation representative. It also partners with UNICEF, the Bill and Melinda Gates Foundation. Okay, so we have another connection between Bill Gates and this Gavi. Gavi also partners with the World Bank, donor country governments, research agencies, private sector partners, vaccine manufacturers, civil society organizations, implementing country governments, and the World Health Organization. So that's another organization that's also giving money and funding some of these vaccine manufacturers, which I believe Moderna was one that they were funding. CEPI definitely funded Moderna. and AstraZeneca. We have the Bill and Melinda Gates Foundation, the CEPI, we have Gavi, and then we also have another organization that funds, gives funding to vaccine manufacturers. It's called AIVI. It's the International AIDS Vaccine Initiative. So that was founded by the Rockefellers in 1994, and they are funded by a bunch of individuals and groups that fund them, including the Bill and Melinda Gates Foundation, CEPI, the World Bank, the Hearst Foundation. So here we have another tie between Bill and Melinda Gates Foundation and CEPI to this IAVI organization. So we have the Bill and Melinda Gates Foundation, CEPI, GAVI, IAVI. So we have 4 different organizations that Bill Gates is tied to that are tied to the vaccine manufacturers. So there is a connection there, that we can see. And then the question is kind of, okay, so first of all, why do these vaccine manufacturers need this kind of outside funding, right? Like, let's say if you're a company, you're going to make a new product, like McDonald's is going to make some kind of new McRib sandwich or something. They know that their new product is going to make them money. So they're going to take some of their working capital and they're going to invest in the research and development and the marketing and the packaging and all these things. And they'll invest that money into it. When they launch the product, they know they're going to make a profit and make that money back and then some and profit off of it. So these drug companies, they know that there's a high demand for this vaccine, that the government's going to be purchasing it, that they're going to be selling it. So why do they even need this outside funding? It kind of is interesting that they would need that kind of money, and then the other thing is that, and then I know this and just working in different, different field, different organizations, especially in nonprofit, that if somebody gives you a grant, it's not like they just show up with wheelbarrow money, dump it out and wave goodbye and that's it. There's an application process that has to be implemented. There's certain qualifications that have to be met. There's certain requirements that have to be met in order to qualify for the grant money or this money that would be allocated. And then there's also reporting requirements too. They're going to require some information. These outside third parties that give money to organizations or companies, they essentially have a hand in influencing your internal operations, influencing what you're doing. They don't have total control over it, but there's always money, there's always strings attached to that money, right? So whatever those strings are can kind of manipulate or change the internal workings of what they're doing. So there is that whenever money is attached, there's always a possibility that there could be influence there. There are these connections there, and people are concerned about it. And this kind of goes with the intuition where people are feeling uncomfortable with certain connections and not feeling good. Like I said about before, where the cosmetics, when you're a consumer of cosmetics and you prefer not to purchase cosmetics that were tested on animals, you have that information and you choose not to consume that product. Or, a lot of people really like organic produce because they don't want pesticides on their food. And so they're able to get that information about the produce being organic, and they can even maybe trace it back. Maybe they just buy direct from the farmer because they know where it's coming from. So, with our food and our cosmetics, we want information so we can be informed consumers. And the same thing with our vaccines. We want information about where are these coming from, who are the people developing it, what are their philosophy, what is their ideology, what is their production like, and that's information that can affect your decision that you're going to make going forward. And then, maybe there's people that don't want that information. They don't really care, and that's fine too. Okay, so there are also some concerns that people have brought up about potentially, and this is again with the intuition, people are feeling like potentially this, they're saying essentially this could be the mark of the beast, right? So for somebody who has a spiritual life, this is something that's important to them. This is something that might be a concern. They've read about the mark of the beast in the Bible, and they're, looking at real life and making a connection there. So to a lot of people, this will sound ridiculous, and this would be something you just dismiss and say, that this is not even an issue. Why are we talking about this? But if this is your concern, then it's a concern, because all the concerns are valid concerns, right? It might not be a valid concern for everybody, but for the person who has it, it is. So, and again, it might sound ridiculous, but a lot of things sound ridiculous, and sometimes they are, and sometimes they're actually not. Like if you lived in the 1700s and somebody said to you, I'm gonna build this incredibly huge machine, and 200 people, we're gonna pack 200 people in there, and then the machine's gonna lift up off the ground, fly through the sky to the other side of the world, and then land back down, and everybody's gonna get out and just have a great time. And people would look at you like, are you insane? That's not a thing. Haven't you heard of gravity? A big, huge thing is not gonna come off the ground. And it's really cold up in the, at that altitude. Everybody would freeze to death. That's not a thing. That's not gonna happen. You're nuts, But obviously, fast forward, people fly in jets all over the place, and we don't even think twice about it, So sometimes things sound ridiculous, and they really are, and sometimes things sound outrageous, and it's just that we haven't really thought about them enough, So let's talk a little bit about it. So there's a man called Hank Hanegraaff, and he is called the Bible Answer Man. So he's kind of like an authority on Holy Scripture, and he's able to give a lot of answers. And somebody asked him the question, what if this vaccine is the mark of the beast? And so he gave an answer, and he pretty much, to make a long story short, he pretty much said, the mark of the beast isn't like this X on your head, or this like tattoo you have, or a hat you wear, or something like that. It's not like this superficial external characteristic. It's really, the mark of the beast is talking about the intentions of your heart, what you're directing yourselves towards, what you want to do, like inside, what your desires and intention is. It's more to do with that. So and I think he gave a really great explanation, and I think that was a valid explanation. However, then he jumps to the conclusion that therefore this can't be the mark of the beast. But if we take a step back and we think about it and say, okay, so the mark of the beast would have to be something that has to do with your behavior, it has to do with your actions, it has to do with your intentions, right? Do we have the ability to manipulate those actions and behaviors and intentions? Of course we do. That's the whole premise of a psychotropic medication, right? A psychotropic medication is used to change the thinking and the behavior of people with anxiety, depression, schizophrenia, bipolar, various, mental health issues that are addressed through psychotropic medication. So, and like I said before, like in World War II, you had, and probably veterans probably have even, stories and testimonies of other drugs being used in other ways, to increase the combativeness during, war, or, just being used to change the behavior or direct that behavior towards a specific goal or way. So it's not entirely, out of the realm of possibility that could, be possible, I could go down a really deep rabbit hole with a lot more research and information about that topic, but that would probably be a whole nother podcast, and this is long already. So really, what we have to do is we have to ask ourselves this: do we have the technology to be able to manipulate someone's behavior or thoughts? And do we have the ethics to not manipulate someone's behavior and thoughts? Yes, we do have the technology. We have unlimited resources, unlimited technology. I'm not fear-mongering. I don't believe in fear-mongering. But we do have to ask ourselves, do we have the technology to be capable of manipulating someone's thoughts and behaviors? And do we have the ethics to say, no, we wouldn't do that? Right? So let's say I have unlimited resources. I have all the money, all the technology, the human resources, everything I could possibly need, I have in order to do my experiment. That I have this idea that I'm going to be able to, control people. I can use other people to do what I want them to do. And maybe they don't even have to know about it, or maybe they do know about it and they just do whatever I say, almost like hypnosis, where we can just hypnotize people and have them do what we want them to do. Let's say I have unlimited technology and resources and everything in place to do it, and I know it's going to be amazing and I'm going to get my results, and it's going to be very exciting, as a researcher, to be able to succeed like that. Would all of that be outweighed by my ability to say, yes, I can do it, but I'm not going to do it because it's wrong? Would we be able to, as a society, even though we can do these things, pull back and say, you know what, we could, but it's not right. We're not going to do it. No, not okay. We're not going there. So that's kind of the question we have to ask ourselves. What do we think about that? And I'm not saying the vaccine is the mark of the beast, and I'm not saying it's not the mark of the beast. I don't know what the mark of the beast is. I don't know what the criteria is for it, but I like I said, I could explain in another podcast that we do have technology to control other people and their behaviors and their intentions and what they're doing. How that would affect their spiritual life and everything else, I that's another topic. But just to dismiss people and say, oh, you're nuts because you think it's the mark of the beast, I don't think that's fair. I think we need to have a conversation about it and investigate it a little bit further. And like I said, I don't believe in fear mongering. I'm just discussing whatever's on the table. We're not going to throw anything off the table, and that's really what I like about being able to make a video, is because I'm not working for somebody that says, this is the agenda, say only these things. I'm just a person at home making a video, so I'm sharing the information that I think we should share. So and I think that's one of the beautiful things about the internet, is that we can get information out there and share it with each other. But I do think that nobody should really use their position of power to influence somebody's decision one way or the other, because you don't know the individual person. You don't know their health situation. You don't know what's going on with them, right? So you have this attorney, Lynn Wood, who puts out a tweet where he says, don't get the vaccine. I'm not quoting directly. I don't have the tweet in front of me, but he says, don't get the vaccine. So why is an attorney giving empirical medical advice to the public? You don't know the people and what their situation is. There's also, I have an example of a pastor.
And I want you to tell me the truth. Is there a vaccine coming soon?
Yes, Father.
You see that? Right? We're waiting for a vaccine. And you got to remember, I was talking with Father earlier, and I said the Messiah, for the Jewish people, they've been waiting for centuries, and he came in our Lord and Savior, Jesus Christ, because of eternal life. Now, the vaccine is not a Messiah, but just think about how much we need this vaccine in our heads and in our hearts.
Keep in mind, the vaccine is not authorized, not approved, not authorized for anybody under 16 years old. Why we would market it to children, it doesn't make any sense. Okay, so now that we've discussed some of the issues people have brought about intuition, and again, this is already long, so we can't discuss every single thing, but I'm trying to give a good overview. But now we're up to the N. So N is, what would happen if I don't do this at all, or if I delay it and I wait? So, and a lot of people maybe are still in the information gathering process, and they do want to delay it. What could happen if you don't do it? Well, nothing could happen, right? Nothing could happen, or you could get COVID and you could get sick and you could die. You could get COVID, you could be asymptomatic and, potentially develop immunity or potentially spread it to others. You could get COVID, get sick and recover and develop your own natural immunity, which we already talked about. But let's talk about herd immunity, right? So maybe people want to wait until there's herd immunity. Herd immunity basically means that enough people in the community have gotten it and gotten immune, or gotten a vaccine and gotten immune, either artificial or natural immunity. Enough people are immunity that this thing isn't going to really spread anymore, and it's kind of run its course. Okay, so let's talk a little bit about this, and you can even try and do this for your own community as well. So I'm in New York. And so I took some of the data. I took the total number of positive cases in New York, And then I subtracted out of that the number of people that died, because obviously if they died, they're not in the community with immunity contributing to herd immunity. So the number of people who got COVID and are still alive, right? Took that number. Now, the CDC, according to the CDC, they have stated that for every person that's diagnosed with COVID, there are 8 more people in the community that are undiagnosed, right? So they're saying that there's a lot more COVID in the community than we realize. So if we take the number of people in New York that have had COVID and survived, we multiply it by 8, okay? And then we add to that the number of people that were vaccinated, which I think it's actually much higher now. When I did this math, it was like 1.5 million. I think it's like up to 2 million. And of course, every day this would be increasing as well. We take that number of people that are vaccinated. So we have the number of people that have natural immunity. We have the number of people that have artificial immunity. And so that's a total immune. And then we calculate the percentage of that out of the percentage of the population, which is almost 20 million. So we have like 12 million people that have potentially have immunity. Out of 20 million, it's about 64% of people. So 64% of people in New York right now should technically have immunity. So we're pretty near herd immunity according to this calculation. Now I say we're pretty near herd immunity because herd immunity was always around 70%. So herd immunity was always about 60-70%. So traditionally, yes, New York would be at herd immunity. However, we have Dr. Fauci, who is quoted as saying that herd immunity is 80 to 85%. And when he was asked about that, how did he come to that conclusion? Because it was different from what was accepted. He said they nudged it up a bit based on public opinion surveys. So I'm pretty sure that Fauci knows that this is not the accepted way. This is not the right way to change an accepted scientific standard, right? This would normally be done based on research. It would be really a collaboration of the medical community coming to a consensus based on data and research, and then deciding what would be the best practice going forward. Not just one person changing the standard based on public opinion survey. That is, and I really do believe he knows better than that, and as a scientist, but maybe as a person with political power, he felt a little tempted to just kind of take that power and utilize it to make a change that wasn't scientifically. So, you know, you're a scientist and you're also now a political person, and the two things seem to get crossed there a little bit. This makes it difficult because we're all trying to navigate this and, you know, figure this out, and the goalposts are moved around while we're trying to figure it out. So it makes it very difficult to do. But you know what, you could figure out that you could take some of those numbers, and I'll post the math problem, how I did it. You know, is it 100% accurate? No, because there's other variables that could be in there. You know, like the vaccine's not 100% effective, so some of those people won't be immune, and also some people will be immune compromised, so maybe they won't develop immunity. You know, so there's a lot of factors that play into it. It's a general estimate. It's not, you know, exact science, but it can give you an idea of your community, where you're at. And that could play into, you know, whether or not you want to have the vaccine. If you're feeling like my community is really at what is accepted as herd immunity. Okay, so to sum up, we've talked about the benefits, the risks, the alternatives, what our intuition might say. We talked about what if we don't do it now. So that's a tool that you could use with any healthcare decision, just gathering information about each one of those topics.
Some additional tools you can use to gather information: the National Vaccine Information Center. They've got that guide with the 8 questions where you can use that to ask some questions to gather more information. The Pfizer EUA fact sheet, that's something that you might want to access as well as the Moderna EUA and fact sheet. The VAERS website, so there you can go and look up what different vaccine adverse reactions are for different vaccines, and you can also register your own. Hopefully you don't have to register any adverse event, but if in the case that you did, you could always access that website. It's a good resource. The Charlotte Lozier Institute, they're the ones that put out that guide that would guide you about the information on aborted fetal cells, insect cells, monkey cells, hamster cells. And they also, on that document, list out which country the different vaccines are from. If you'd like that information, you can access that document there. You could also calculate the herd immunity in your community if that's something that you would want to do. And it's also always a good idea to just check out your patient's Bill of Rights for your state. In New York, it's health.ny.gov, and there's good information on there. There's they have a brochure deciding about healthcare, and it explains what your rights are as a patient. So that's always good information to have as well.
And then talking to trusted people, people that love you, people that you trust, your family, your pastor, your healthcare provider, your doctors, your nurses. You're talking to those people, taking the time to really digest the information and think about it and process it, thinking about what your gut instinct is about it. If you're feeling like, you know what, I really need this vaccine, this is what I need to do, or you're feeling like, you know what, something's telling me I still want to research it, I still need a little more time. Taking into account all of those things, right? You should never just do a medical procedure without having some kind of informed consent. Like I said, I'm not saying that I know everything. I'm not saying I know what you should do. That's your decision. I'm definitely open to, constructive criticism and feedback and, having a discussion, because I think it's important for us to be able to have open discussions that aren't forced by someone else's agenda, to be able to come to a good place where we're feeling comfortable with our decision. Because remember, you have to live with your decision, not your healthcare provider, not anybody else, not whoever's telling you one way or the other. It's you that has to live with the decision, so you have to be comfortable with your decision. And I would support people in whatever they chose.